So now we will be starting with the next part of the same chapter, that is rabies example. Now you have the idea of zoonosis. You should know what happens in the zoonosis. What is the reason for zoonosis? So I should say we will take the example. So rabies. Okay. Now rabies is the example. I have already talked about the classification last time. Okay. So according to classification, rabies comes under uh, one part, that is infection transmitted to man from lower vertebrates. So anthropozoonosis. Okay, rabies. So it's an acute viral disease which causes encephalomyelitis in virtually all warm-blooded animals, including man. Causative agent found in domestic and wild animal and is transmitted to other animals and humans through close contact with their saliva. Now, if we talk about rabies, then always mm, dogs, okay, stray dogs, canines, most of the canines. Rabies virus can be present in squirrels, in cats also. It may be present in many animals. So on most of the warm-blooded animals. Okay, so anyone bites, even the monkeys bite you. You should be very careful. Or you have to take the rabies vaccine. Reason is you never know if that monkey or that particular animal was actually infected with this virus or not. Okay, so it is necessary that you should know exactly uh, whether that animal was infected or not. Now, most of the time dogs, because we come close with the dogs, they also go through the vaccination. If you have a pet dog and he has been vaccinated properly, and if that pet dog is not allowed to come in contact with the stray dogs, okay, and then there is a less possibility that the particular dog will have some this particular disease, rabies. But you should know exactly how it works. So causative agent found in domestic animals, bite, it is present in mouth, saliva. Okay, and once the saliva, if you they bite, there will be puncture in the skin, and because of that, what will happen, it will get transferred into the blood, and the infection takes place. So why it is so important, man? This is important zoonotic infection in which man is dead end of the infection and hence does not play any role in spread to the new host. Remember, a man is the dead end to the particular virus, means man doesn't bite actually to others. Man will have this infection, he will have all the symptoms of the rabies. Okay, but generally man doesn't become that much of violent as we have seen in animals, like many of the animals become violent, dogs become violent, and that's why they start biting others. Okay, they become very much what we say, irritating, they get irritated by many things. We will discuss that. So most of the developing country, dogs are the principal reservoirs of rabies. Okay, canine rabies, that has been called as canine rabies. Whereas sylvatic rabies involving animals such as foxes, raccoons, as you can see, coyotes are the principal wild animal reservoir. So any wild animal or any domestic animal, they may have this vaccine. So either that particular animal was having this rabies or not. If they bite, you have to take the vaccine. Okay. So what are the causative agents of these rabies? So rabies virus belongs to the family Rhabdoviridae, genus Lyssavirus. Okay, that is called as rabies. So this RNA virus is a bullet-shaped virus, round at one end, flat at the other. The virus is covered with the lipid envelope, okay, having spike-like projections. What is the mode of transmission? Okay, now rabies virus is predominantly neurotropic and kills the host in a short period. Okay, neurotropic. They attacks on the nerve cells, and due to damages to the brain cells or nerve cells, person may die very early. Okay, there are some medicines, vaccines are there. So even person get infected, he can recover. Okay, but it is necessary that all the medication should be given. So before death, from the brain, virus reaches salivary gland and excreted in saliva. So excess of saliva in animal or in humans, excess of saliva will be secreted. Okay, and because of this excess of saliva, uh, this particular disease may get transmitted. Okay, for example, even though a person is having the rabies and saliva is getting secreted continuously, a person who is looking after it, he should be very careful. The reason for that is, if suppose that person is having one cut on his hand or anywhere, and the saliva come in contact with that wound, then the rabies will enter into the body. So you have to be very careful. Okay. So saliva gains entry from another host. So pre-existing breach in the skin, what we say, by leaking or contamination. Okay. Virus may be present in saliva for many days before clinical sign appears, and it may steadily or intermittently secreted until just before the death. Okay. Then the report of preclinical periods of viruses secretion in saliva range from 3 days in cats, 12 days in Mexican free-tail bats. See again, bats are there. Bats also have this particular virus. 14 days in dogs infected with Ethiopian virus, led to 29 days in foxes. So incubation period is vary from 3 days, 12 days, 14 days to 30 days. It may vary from animal to animal, depends. But this is what happens. So in animals, what happens here? In dogs, specifically, if we talk about after an incubation period of around 3 months, okay, 10 days to 6 months, dog may manifest one or more of the following clinical features. Now, this is very important. What kind of infection actually takes place? So there may be change in the behavior of dog, change in the bark tone, change in feeding habits. Animal may go off feed and eat abnormal objects. See, this is very important. Behavior of dog changes. Okay, barking tone changes. Feeding, it will try to feed on very dry things. Habits of normal habits may change. Animal may go off feed and eat abnormal objects. This may happen. Now they may develop fever, vomiting, excessive salivation. This is one of the thing. Excessive salivation is one of the symptom. Okay, excess saliva, it will just come out. Generally dogs, when they breathe, they open their mouth. Okay, their tongue comes out. A little bit of saliva generally oozes out of the mouth, but excess will be there. Okay, paralysis of lower jaw may happen. Restlessness will be there. Convulsions, paralysis leading to death may happen in 5 to 7 days of the disease. And rabies in the dog is also classified as a dumb or furious, means predominantly paralytic manifestation has been observed. Mainly convulsions and aggressive behavior uh, may happen. The dog will be very much irritating. You try to touch him, he will try to bite you. Okay, so this is a very important, I should say, uh, tendencies that about the person or the animal who is having rabies. Now, clinical features in cats and cattle. Yes, if they are infected, they may get this. So, what kind of observation you may see in that? So, rabbit cats or cats show extreme aggressiveness. This is a common again that we have seen in dogs. great sensitivity to touch, voice, profuse salivation, and may attempt to attack dogs or man. So attacking is one of the thing. Aggressiveness, what we say. Even if you try to touch it, so as I have told you, the behavior changes. Okay, cattle's manifestation: abnormal movement of posterior extremity, foamy yellow froth from mouth, and decrease in yield of milk. This will be the one of the reason. Means if milk yield has been decreased in cattle, then you have to look after it. Maybe and one more thing, at the same time, if yellow froth is there from the mouth, then that particular cattle definitely is having the infection of rabies. So that may happen because of some bite or something else, but it has happened. So you have to take look after it. Milk of these cattle going to have viable rabies virus, and its ingestion in raw form may require post-exposure treatment. Okay, so in those individuals who have ulcers or abrasions in mouth or pharynx, otherwise gastric juice destroy the rabies viruses. It is there. So direct injection, it does not actually infect the person, but yes, there is a possibility that if direct infection doesn't take place through the wound, blood mixing is important. Okay, if it is you come in contact or directly it enters into the mouth in esophagus, it will be destroyed. No problem with that. So what are the exposure treatment in humans? Because of the long incubation periods, okay, which is a typical of most cases of human rabies, it is possible to institute a prophylactic post-exposure treatment. Okay, this must be started at the earliest to ensure that the individual will be immunized before the rabies virus reaches the central nervous system. So, the first thing we all know that what kind of precautions that we have to take or what kind of treatment person has to take to counter this virus. So, the first thing is if dog bite takes place or any animal bite which is having any animal bite, even though if it is not infected by rabies or whatever, you have to be very careful. You should wash the wound, okay, with soap, so that maximum amount of virus, if it is there, it should be destroyed by the soap itself. Even though if it has entered the blood, you have to take the injection. Now there are many people actually what we say afraid of this vaccination. The reason is previously they used to give this vaccine in the stomach area skin, okay, and it was very painful. 14 injections you have to take to counter this virus. Now there are new vaccines where you don't have to take 14 injections, 2 or 3 injections are enough. Even you don't have to take it in the stomach area. Okay, dermal injections are also there within the skin itself. You can give the injection. So there are injections. Immunization is important. If you don't go for immunization and the virus increases within your body, then definitely it will go towards the paralysis of that person, and person may die. See, after paralysis, person will not able to move, but paralysis may increase during in the area of respiration, remember, and heart. So if respiratory system which is controlled by the nervous system, and if nerve cells are damaged or something happened to them, then after paralysis naturally the respiration may have some problem. Because of that the person may die. Okay, so this is about the rabies. So rabies causative agent is virus, remember. Zoonosis it is, and transferred from animal to humans. What kind of animals? Most of the warm-blooded mammals are there which are having these viruses. It transferred through what? In saliva it is basically present, and it generally transferred or get infection when an open wound is there. Okay, so animals will bite you. At that time, the saliva will get mixed in blood. Okay, so these are all the things related with the rabies. So next chapter will be related with the toxoplasmosis. Okay,